We take our students on field trips.
Very important.
That it is really core of the business, not some add-on that we do on the side. Knowledge of how things happen, of the practices on the ground.
Hello, this is Angel Imdad, and we are at the Micro Studio with yet another interesting episode of GreenTalks. GreenTalks is all about the sustainable initiatives a person takes or they take at a company level, so that आप भी अपनी sustainability game को strong कर सकें. I'm very glad that today we have an amazing and the leading name in healthcare and education sector, AKU Aga Khan University Hospital. From there, we have the amazing Miriam Kugele with us, and she is the Director of Sustainability at a global level at AKU. Welcome, Miriam.
Thank you for having me. It's an honor.
Thank you so much. AKU is, of course, the reputable name in healthcare and education sector. But what inspired AKU to get sustainability in their core business of every sector?
Thank you for that wonderful question, and also recognizing that it is really core of the business, not some add-on that we do on the side. What inspired this is many, many years of work as part of the Aga Khan Development Network. Right? We have a larger network, and as a development network, we've always done a lot of things relating to environment, sustainability, and climate, from disaster relief and management, from obviously healthcare, education, sustainable agriculture, and many, many more. Some of those, of course, relating also to the core business of our university. And some years ago, about 5 years ago, some of the leadership of AKDN said, it's really now time. This issue of climate change is so urgent now. It might be the most urgent, if not existential issue of our time, that we need to be explicit about doing this work. Beforehand, it was more implicit. We all did the good work, but we didn't necessarily coordinate and represent it that way. So we came up with what is now called the AKDN Environment and Climate Commitment Statement. It's effectively a policy that guides all of the work that we do across the development network. And it's guided by a few principles, including, of course, environmental responsibility and paying responsibility for our actions, local laws, etc. Secondly, working with the most vulnerable. And that is really important in the geographies in which we work. That's 32 countries of Central and South Asia, as well as East Africa, across the network, where we are most exposed, most susceptible, and have the least capacity, therefore are most vulnerable to the impacts of climate change, and historically not as responsible. The fourth principle is to lead by example. So to maybe do some of the work that others find challenging, and really to showcase what is possible, even in low and middle income countries. And the fourth is then to share that knowledge widely, right? To bring others along. And as a development network, again, that's part of our responsibility. And as you said, this is now part of the core of what we do, right? And so even at AKU now, we have a 5-year plan that was published just earlier this year. And one of the 7 core areas, or 7 principles, seven goals of it, is around environment and sustainability, right? Covering everything from research and education to engaging with partners and suppliers, to, of course, our net zero goal, which is the operational emissions reduction goal.
That's amazing. And knowing that there's an entire policy that regulates around it, and all the operations are centric towards it as well. Coming back to it, as you mentioned that there's a lot of institutional work, and you are leading with the name, and because of course AKU has the resources and they can develop multiple things too. But at the same time, a lot of young people are coming to AKU for multiple courses that they do over there. So how the youth is engaged in terms of sustainability?
Yeah, and a really important question. Thank you. So I'll just refer again to our 5-year plan. But even beforehand, our kind of educational goals actually had this, one of the, I think, 9 educational goals, to be responsible citizens. So we wish for all our graduates to go into the world to be change makers to one extent or the other.
Definitely.
And increasingly, that means to be climate literate. Now, what does climate literacy really mean? It means to be knowledgeable, so to be able to process in a very complex world of information these days, to process, select, and work with information, and then use it to the best of our abilities for proactive change for both human health and planetary health. So there's a few types of processes, I suppose, that we've kicked off over the last few years. One, we started more at the kind of extracurricular level for all our students. So, for example, there's environment and climate related clubs or student societies on all campuses of AKU. We are just about in the process of running for the third time this year an annual initiative around ideation around climate change. And there's a bit of a different theme each year because climate change otherwise is a bit too big.
Very
so
big.
This year, for example, we have the theme of water, which again in all our geographies is very relevant, around too much or too little water, water access, gender aspects, etc. So students come together as teams, get some more information and are trained on climate content, and then come together to propose ideas, not just for our campuses, but for communities in which they also can work. So that's kind of where it started, but increasingly the conversation is much more around also how we can integrate it into the existing and longitudinal aspects of education, right? So how is climate relevant to all the things we teach, right? And how can it be integrated, again, rather than added on? So whether it's medical education, climate and environment is absolutely relevant, or whether it's, for example, in the Institute of Educational Development, where we're training and supporting teachers, or our School of Media in East Africa, for example, climate really cuts across, right? And sometimes the argument, I'm sure you've heard it also, is that every job is a climate job. Right?
Yes.
So that's also how I, for example, work with all of the colleagues, right? We have 19,000 employees across AKU. And similarly, the idea is that we all have our role to play, whether you sit in finance, whether you sit in HR, whether you sit in marketing, etc. My office is kind of just a facilitator, right? And we really want this agenda to be as horizontal and integrated as possible. So we have various initiatives and campaigns and support mechanisms around that as well.
That's amazingly put into words, that the whole organization has to understand what are the environmental impacts they are creating and how it can be reduced. I can totally second when you said that whether they are medical students or they are coming for a different course, they are taught about the environmental conditions and impact they might create. Because I have like twice invited to the nursing college to talk about the biohazardous waste and how they can reduce the impact at their level. Talking about the waste, and biohazardous waste is one of the biggest problem in every corner if we see, like all part of the world. So AKU being the largest name in healthcare sector, so they must have been producing a lot of waste as well. So what are the strategies to deal with it so that they don't go on the roadside or impacting our water bodies? So what are the strategies toward that?
Yeah, waste is an ongoing challenge, and it'll never fully go away. Hospitals will always produce waste, and some of it will be biohazardous, which by law in any country, of course, as you know, needs to be incinerated for health and environmental reasons. So let's say we have a few different types of waste, right? So there's the biohazardous, and there's the municipal waste, which here in Karachi goes to landfill. So we try to work with the best possible vendors to ensure that, as you say, it doesn't end up only just on the roadside. And become a hazard. Then there's things that can be recycled. So we really try to sort out, as much of the paper and plastic so that can directly, without being wet or otherwise tainted, go into a recycling process. And then there's food waste, right? And on the food waste, for example, we're really trying to work with teams and feeding back some of the data into the teams to say, well, this is what it is and what are your ideas to go forward. And there's a really wonderful example I'd like to share because it's an indigenous or homegrown actually idea around the biohazardous waste. So we realized through, you could say, a mini waste audit that some of the biohazardous waste bags contain things that weren't biohazardous.
Right.
Let's say little juice boxes or tissues or even paper and just anything.
Which can be recycled.
which should not be incinerated
Right,
and could end up being reused or recycled or going into other waste streams that are less environmental damaging. So when we realized this, we thought, why would that be? Why would the juice box, to take that example, be in the red bin, the red ones that is incinerated? And so we reflected where these red bins are. And some of them, for example, are on the patient's bedside, right? But let's say you're a family member, a visitor coming to see that patient. You have your juice box, and then you're just going to throw it in the bin that's there.
They don't understand
and you're not going to
that.
think any further because you don't know what a red bin means. Totally. Right? And that's entirely understandable. So in fact, the housekeeping team, together with the nursing team, came up with this idea to put the red bins for biohazardous waste on a wheelie trolley.
Okay.
And that wheelie trolley now, which didn't cost very much at all, even across our entire hospital operations, that wheelie trolley now is taken along on the rounds. So the nurses and the doctors and staff who are trained to know what should belong in the biohazardous waste bin, they take that along. Okay. And on the bedside, where the juice boxes and tissue boxes still land, there is a so-called green bin, which is the municipal, what ends up in the municipal waste. And so this was just an idea. As I say, it didn't cost much. We just had to train and remind people. And that's quite an important aspect, actually, is to remind people, right? And to share some of the data forward. And it's, over the last 2.5 years, reduced our biohazardous waste by about 20 to 25%. And we can trace that according to patient volumes, right? Because, of course, that varies over time. But now we can really understand this pattern. And given that it barely costs anything to implement this, it's one of those really wonderful practice changes that are so important to think about. Because generally we think technology is going to save us, right? Renewable energy, all of that is absolutely important. But a lot of the solutions are indigenous, right? And appropriate to our hospitals that might not work in other parts of the world, etc. And why I'm saying all of that is that it's so important to work with the teams who have the knowledge of how things happen, of the practices on the ground. And they will come up with fantastic ideas if they're empowered, if they're listened to, if they have access to the data that we share back with them.
Definitely, definitely. And perfectly said that indigenous problems needs indigenous solutions. So I guess the ways that you mentioned that has been reduced by 25 to 30%, I guess that's a tremendous number. And at the same time, I guess the resource management that we talk about, if it's a valuable resource that can be recycled, and that's just going for incineration or landfill, it's a resource being damaged, or that can be recycled, and that's the best possible way. I guess that's a tremendous work that you guys are doing. And at the same time, Miriam, normally when you are there implementing solutions, when talking about the indigenous people, they are not aware of, or they don't understand, or maybe different departments in the AKU team only, they don't understand the fact that why you are doing this. So there must have been multiple challenges to implement these ideas towards sustainability. If you can share some of them, because multiple people might undergo the same challenges at their institutions as well.
So as you mentioned, I guess resistance to change is somewhat human nature, right? We're all uncomfortable with change. We are very, very habitual. That's, I think, human nature. And that has various reasons at an institutional level also, including, as you say, sometimes lack of knowledge, right? So over the last years, we've really worked a lot across the different departments to share some of the work we're doing, to share some of the reason why AKDN has such a strong policy and strategy around this explicitly, as I said, but also really to listen, to understand people's fears. So it takes time. That is then the repercussion of that challenge, right? I think what's really important is then the role of leadership, right? And as I said, this is at the AKDN level, but also the AKU leadership is really strongly supportive of this agenda. And you will just hear the word climate, sustainability, etc. throughout, right? So that's been really important to overcome it. Another somewhat related challenge I feel in this part of the world is that we're very often told that the global south or low and middle income countries are not historically responsible for climate change and therefore the impacts, although we end up being most vulnerable. And that discourse then, or that sentence then quickly follows with, so we shouldn't really do much, except maybe adapt, right? And even at the policy level discussions internationally, we hear, countries and low and middle income countries kind of asking for money, for example, right? Or technical support, etc. So the loss and damage discussion internationally, for example. But I feel that doesn't necessarily help us moving forward on the mitigation front, which is a lot of the work that we're doing. So that's emissions reduction, waste reduction, etc., etc. And it doesn't help us necessarily feeling empowered and therefore proactive. But we're inundated with this terminology. Whenever you open a newspaper, it's kind of victimization. Right? And to overcome that is not easy.
Not easy at all.
So some of the work, again, that we're doing, let's say, for example, even more with students, is that, or in the courses that I teach and many of the other faculty members as well, we take our students on field trips.
Very important.
And we get them sometimes to do very practical work, get their hands dirty, which actually in other terms means connecting with processes and connecting with the natural world, etc. And many students or staff members either have never had that opportunity in their lives. And when they feel that connection, even if it's just in a 1 hour activity, something does change. And they feel a bit more active or
active and connected. They want to come up with a solution.
Correct, right? But all of that change takes time, right? And so that's another one of the challenges. I suppose also at an institutional level and in healthcare in particular, the global nature of our supply chains is another one of the challenges. A lot of medical and surgical supplies and pharmaceuticals, etc., do have to be imported. And so that's, of course, extremely expensive, but it also has all these issues that, for example, during the pandemic really became
must have been really difficult.
An issue as well, right? But when we're talking about sustainability, that's kind of important to note too, because we don't necessarily have immediate access to some of the more energy efficient equipment, for example, that just doesn't get supplied to this part of the world. Or if it does, then there's no maintenance for it. So we can't take that risk, right, as a healthcare institution. So we're really working a lot with suppliers globally and locally to improve some of those processes, to improve capacity of our suppliers here, to address sustainability within their own operations. And similar aspects.
Perfect. And to maintain the name, of course, and the perspective that people have with a particular name and healthcare sector, that's not easy as well too. Miriam, I guess as you being the leader in sustainability of AKU, at a personal level and maybe at the institutional level, what are the basic sustainability initiatives that you take in your personal life on a daily basis that maybe the viewers listening can adopt as well?
Yeah, good question again. Thank you for asking. So again, it's quite context dependent, right? What we're able to do. I admit that due to my job, but also due to my international background, for example, I fly, right? I fly, let's say, a lot, right? And actually, we as an institution also do. It's one of our big challenges, but we're an international institution and go to a lot of conferences and collaborations, and that's important, right? So that, for example, is a challenge also for my personal life. That I'm very conscious of. And to be honest, being conscious, and I tell my students to be curious, is often the first step to change. One of the things I do relating to transport locally is to carpool as much as possible. We do require transportation in a big city like this, but even going back and forth to the office, and increasingly also, for example, for school drop-offs, I really hope to carpool, right? Which reduces 2 cars going to 1 car going, or 3 to 1, etc. Right? And it's only a matter of coordination, right? It doesn't have to be impractical, I feel. In terms of purchasing patterns, I feel there's a lot we can do. So the obvious example of just bringing my own cotton tote bag when I go grocery shopping. And I always carry a handbag, so a folded up tote bag really doesn't take up much space. What it always does is it irritates the people in the supermarket whose job it is to pack a bag, and it disturbs their usual process. But I use that opportunity of disturbance to have a quick conversation, and my Urdu is somewhat limited, but it always creates some giggles and some laughs, and that's actually a wonderful learning for both sides.
That way, right? They will remember what you said.
Yeah, because it's unusual, right? And sometimes that's an opportunity for learning. In terms of what I buy, so let's say the place I go to buy vegetables, for example, the vegetables are open. And again, if I bring my own bag, not every vegetable has to be put into a plastic bag, or for things that do maybe require a plastic bag, I reuse one, bring it from home, again, in my tote. So those are small things that, I try to avoid some of the packaging. I think food delivery is another one that I'd like to mention, because I think food delivery in our part of society, let's say, is a very common thing, right? That's when we do what we do when friends are over or in a lazy evening. But it disturbs me a lot how much packaging comes with it. And increasingly, I just kind of don't order food anymore, which, affects me personally then. But at the same time, the worry that the food delivery and the packaging gives me is therefore reduced. So there are these small things that we can do, and it all starts at a moment of reflection, right? And a moment of curiosity to think of, where do all the resources come from? How do I use resources? And then where do they go? Because there is always an end of life to everything. Those would be a few examples.
Perfectly said, Miriam, and I guess that was lovely examples. And as Miriam said, that you have to be curious about what you're using and what is coming from where and what will be its destination. From a leading organization like AKU, you must have learned so many things. And to get to know more, keep watching GreenTalks exclusively on Myco. Thank you.